Good afternoon. Today I'm going to talk about some microsized erythrocyte-derived optical particles that we fabricate in our lab and the effects of blood type on their circulation time. So to start, most of you guys know what port wine birthmarks are. They're congenital malformations of the skin, and they're fairly common, occurring approximately 4 out of every 1,000 births. And they're caused by abnormal vasculature. And there's a current treatment with them. Typically, 585 nanometer laser light or pulse dye laser is used to treat the underlying vasculature, and it targets the hemoglobin found in the blood and uses that as the endogenous chromophore for photocoagulation. However, there are some limitations. Using just the 585 nanometer laser light, only about 21% of patients receive greater than 75% clearance of their birthmarks. And this is due to a couple of reasons. There's a low penetration depth at 585 nanometers, and eumelanin, which is found in the epidermal layer above the vasculature, will absorb highly. And the more heavily pigmented the patient is, the more eumelanin will absorb, which could result in potential injury. So what my lab has focused on doing is trying to shift the wavelength to be more effective at 755 nanometers. At 755 nanometer light, eumelanin the molar extinction coefficient will drop by about 2.6-fold. However, hemoglobin is not the ideal chromophore because it will not absorb as much. And we've identified indocyanine green, otherwise known as ICG, as a potential chromophore because it highly absorbs at 755, it's low toxic, but it does have a short circulation time in human vasculature. And this is why this is why we've been combining erythrocyte ghosts and loading them with ICG to create near-infrared erythrocyte mimicking transducers, which we call NETs. These NETs now have the characteristic self-marker membrane proteins found in red blood cells. CD47, 55, and 59 are present in both the erythrocyte ghosts loaded with ICG and red blood cells. So after this, we want to determine how long the circulation time could be. And for this, we used a mouse window back model where we are imaging the dermal side of the window chamber, and we are illuminating the epidermal side with 785 nanometer light. And here we can see some results of our intravital near-infrared fluorescent imaging, where we have, with free ICG, there was a peak of 47 seconds, and then after 30 minutes and 60 minutes, we saw very low nets in the ICG in the circulation. Compared to micronets, the peak was at 3 minutes, which is the half-life for free ICG. And we extended this window where at 30 minutes, we still hadn't reached the half-life, and at 60 minutes, there was still a pretty decent amount of nets that we could see in our images. One of the things that our group has been focusing on is extending this further. So we've been looking at concentration along with something called phosphodiesterine, otherwise known as PS. So when we fabricate our particles, PS, phosphodiesterine, will flip from the inner membrane to the outer membrane. And this phosphodiesterine is a marker of apoptosis, where macrophages will come uptake these red blood cells. So we've been trying to limit this to as low as we could possibly go. And what we've also been looking at is the effect of blood type on the mouse circulation model. And what we found is with O-positive blood, we have a much longer circulation window that we can work with for future studies when we evaluate the efficacy of this model using the mice that Wang Kun just mentioned. And for B-positive blood, even when the phosphodiesterine content was lower, we had a much shorter circulation time. Thank you very much.